Well, this portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.
Joining us live in studio is Dr. Mark Hiatt, Executive Medical Director of Regence Blue Cross Blue Shield of Utah. Good to see you, Dr. Hiatt. And I want to talk about the universal flu vaccine in just a moment. But first, I promised last week that we'd talk about the liquid biopsy. And for anybody who's ever had, symptoms of cancer or a suspicious lump and has had to have that needle that goes into the lump to remove a bit of...
Big needle.
Okay, I've had to have that done. It's terrifying and it can be very painful. So tell us, how is the liquid biopsy different?
Amanda, I've been on the other end of that needle. I've had to poke into people with that large, uncomfortable needle.
Yeah.
And other alternatives in the conventional approach are to use a scalpel and open the patient up to try to secure some tissue or to poke an endoscope down you. Well, liquid biopsy presents an alternative that may be a lot more palatable to patients. And that's where, Brian, you collect a bodily fluid. It could be through urine collection or a blood draw. And so somewhat in a less painful manner, more convenient to the patient, you're able to get the tissue of the tumor.
Think of a bunch of advantages to maybe a liquid biopsy.
So how could it be used to fight cancer then?
Well, we hope that through liquid biopsy you can get the essence of the tumor and perhaps even its DNA. And you're able to genotype it such that you can more effectively characterize that tumor. You can detect it more effectively, track it, treat it, and ultimately defeat that cancer.
Interesting. All right, let's move on now to this universal flu vaccine. I guess as the news reports have been going, the flu season isn't going too well, is it?
Not too well. Yeah. This flu season here in the United States is in full swing. We've heard that it's widespread. Already, unfortunately, 39 children have died this season from the flu.
And how has the flu vaccine this year been affecting it?
Amanda, compounding the problem, the effectiveness of the flu vaccine this year is poor. It may be as low as 10%.
So universal flu vaccine, what are we talking about here when we say universal flu vaccine?
Well, it's a vaccine that would provide robust, long-lasting protection against multiple subtypes of the flu, not just a few strains, as is currently the case.
So the advantages of that would be awesome.
It would be awesome, and I think you already are thinking, Amanda, that it may prevent you from having to get a shot every year.
Yeah.
Rather, one shot would protect you for a long time.
Like lifetime, long time?
Potentially, that would be the ideal, lifetime coverage. More realistically, it may be just for 3 to 20 years.
Wow.
In the time we have left, Doctor, can I switch you to kidney stones? Because our governor suffered from these kidney stones recently. It was public because it was the State of the State address. And I know many of us people around the office who had kidney stones did not know how he did that because they told us how excruciating they are. Tell us just a little bit about this.
Yes, the governor, amazingly, despite his diagnosis on Tuesday, still stood on his feet to deliver the State of the State address on Wednesday.
That's amazing.
Not having these kidney stones, 2 of them, extracted until Friday in surgery.
These can be painful, correct?
Kidney stones,
I'm one of those people who has never had them, thank goodness, but...
Yes, kidney stones have been described as being quite painful as they try to pass. In many cases, they can pass on their own with a little help from pain medication and significant hydration.
Yeah.
In some cases, as in the governor's, they do require surgery.
So what exactly are kidney stones?
They're hard deposits made of minerals and salts that form inside your kidneys. And often these stones form when the urine becomes concentrated, allowing those minerals to kind of crystallize and stick together.
So how do we avoid these things?
Well, the key thing is to avoid dehydration.
Okay.
Not drinking enough water each day can increase your risk. Secondly, avoid certain diets. So you want to avoid a lot of protein, salt, and sugar. And finally, it's said that reducing weight may help.
So stay away from the salt. More water, more water, more water.
Yep.
All right.
There you go.
It's always good to see you,
All
Doctor.
right.
Thank you for your time. This portion of Utah's Morning News brought to you by Regence Blue Cross Blue Shield.
KSL News Time 8:49.